Let's say you came across this question in your nursing exam. It is very easy. Now let's solve together. The question says, while reviewing a patient's documentation, the nurse notes the entry. Now listen properly. What does this entry talks about? The entry says that the patient states, all right, I feel dizzy whenever I stand up. Now here's the question. The question says, which type of data does this entry represent? Now, this question is extremely very easy. From the look of things, this question on the board is on a very vital aspect in nursing called nursing fundamental, specifically focusing on a concept called nursing process. Now listen properly. This question on the board is on a very vital aspect in nursing called nursing process. The question is asking us, which type of data does this entry represent? Before we tackle this question, it is very important for us to understand properly the concept to which this question is from. Now, you must note here that the term nursing process is a systematic method that nurses use to provide safe, effective, and individualized care to patients. Are you there? And this process has various steps. The acronym to remember the steps in nursing process is called ADPI. Now listen properly, all right? Whereby each of these letters here means something. Are you there? Now we are going to come back to the question, but listen properly. The A here simply means assessment. The D here simply means diagnosis. The P here simply means planning. The I here simply means implementation. And the E here simply means evaluation. Are you there? Now listen. In one of these steps in nursing process called assessment, it deals with the collection and organization of data. You can see where this question is coming from, because you can see here that I just mentioned the word data. Now listen properly, all right? In assessment being the first step in nursing process is the process whereby a nurse collects data, informations about a patient. Now listen properly. These data are literally same as informations. Are you there? And they are gathered by a nurse. Now in nursing, data are of two types. We have objective data and subjective data. All right, listen properly. You can see here option A says objective data, option B says subjective data. So take note, when it comes to type of data or types of informations collected, gathered by a nurse in the concept of nursing process, we have two types of data, which are the objective and subjective data. Now, before we determine the answer to this question, we need to understand properly these types of data. Now, the question we ask ourselves, what are objective data? So you can say I said that we have two types of data, objective and subjective data. So what are objective data relating to the nursing profession? Now listen, objective data are those data a nurse observes or measures. Listen, objective data are those data a nurse observes or measures, whereby for subjective data, they are those data that the patient says, all right, or reports. When you ask the patient a question, whatever information given to you by the patient, those informations or data are regarded to be called subjective data. I believe you are following me. So in the course of this question, before we progress to talk about other options here, because you can see option C here says evaluative statement, option D here says judgmental, observation. We have to talk about them. But before we talk about them, let us provide answer to this question. It is very easy. I just explained to you that objective data are those informations measured or observed by the nurse, whereby subjective data are those data that the patient says or reports. So from the question, it says, while reviewing a patient's documentation, the nurse notes the entry. An entry is like a written note. Are you there? And what is in that written note? The patient states that I feel dizzy whenever I stand up. So from this question, it is the patient that is telling you that information. Because I told you that for subjective data, there are those data that the patient reports or says. So it is the patient that states the information. So from this question, which type of data does this entry represent? Which is I feel dizzy whenever I stand up. This information or data is regarded to be called a subjective data. We have other examples of subjective data based on a particular patient's condition. Let's say, I feel anxious about the surgery. This is the patient saying it. So this information or data is also a subjective data. All right. Another example can be my stomach hurts. So that information is still a subjective data because it is not the nurse that is feeling it. It is the patient that's actually saying it and feeling it. Are you there? So this is regarded to be called what a subjective data. Moving over to objective data, there are those data that the nurse measures, and the nurse can measure or observe or get this data or information through various process like observation of vital signs, which include temperature, pulse, respiration, blood pressure, oxygen saturation. So all of these are regarded to be called objective data because these are the data that the nurse can actually carry out, the nurse can actually observe. The nurse can also get this objective data through like physical examination, where the nurse observes the patient from head to toe. So with that, the nurse can also get objective data because it is the nurse that is actually measuring or observing the patient. Are you there? This physical exam or physical examination can be done through the process inspection, palpation, and auscultation. I believe you are following me. So all this must be noted. So I believe now you understand the difference between objective and subjective data. As we are having objective and subjective data being the types of data, also we have what we call sources of data. Now listen, we have sources of data. Data can be gotten via two sources, all right? We have the primary source of collecting data, primary data, all right, and as well as secondary data. Remember, we said that data are information gathered by us, objectively or subjectively. Are you there? Which are the types of data? Now, what are primary data? Which is a source of data collection. Primary data are those data the nurse, because now we are dealing with the nursing profession. So primary data are those data that the nurse obtains or gather from the patient directly. So the nurse getting the information from the patient is regarded to be called what? A primary data. Are you there? Where like I seen in this example where the patient says that I feel dizzy whenever I stand up. For a patient to be dizzy means that the patient is weak. Are you there? The patient is not balanced. Do you understand? So this is an example of a primary data. But secondary data are those data that are gotten from the patient relatives or other caregivers. Are you there? Let's say you ask a relative of a patient a question concerning the patient, and the relative gives you an information about that patient. That information or data given to you by that relative is simply called a secondary data. Or that information given to you by another healthcare professional is what? A secondary data. I believe you are following me. All these are very, very easy. They are not difficult at all. Now, moving further, because I saw that this question is on data. That is why I am stressing on all the key things you should know about data as relating to the nursing process, specifically assessment, which has to do with data collection. All right. Now, moving further, there are various steps in data collection. Now, listen, there are various steps in data collection. The first step has to do with collecting the data. Assessment is the first step in nursing process. So the first step in data collection is to collect the data. Are you there? That's the first step. So I just said that the first step is collect the data. Collect the data. The next step is what we call organize the data. After collecting the data, you then organize the data. I believe you are following me. All right. After organizing the data, you validate the data. Validate the data. And lastly, you document the data. So these are the steps in data collection. Now, let me explain what I mean by this. In collecting data, this is done through maybe observation, vital sign observation, physical exam observation. Are you there? Through interviews. This is the process of collecting data. I believe you are following me. Now, on organizing the data, after collecting data, let's say for instance, you performed blood pressure observation on a patient and you got the blood pressure to be, let's say, 120/80 millimeters of mercury. That data, you have to organize that data. Let's say, for instance, the patient also states that I feel dizzy during the collection of data. You can see that we collected two data. First, we observed that the blood pressure of that patient is 120/80 millimeters of mercury, and also the patient also told us that he feels dizzy whenever he stands up. Now, the second step of data collection is organizing the data. Then we have to organize the data into various aspects. You checking the blood pressure of a particular patient. You know, blood pressure in general is on a very vital system, which is called the cardiovascular system. So you organize that data into the cardiovascular system charts. I believe you are following me. So you now say blood pressure is equal to 120/80 mmHg. That's on the cardiovascular system chart. Then the patient telling you that he feels dizzy. That's like a problem of the nervous system. Are you there? It has to do with the brain and the rest, nervous system. So you just write nervous system. Under nervous system, you also put that data, which the patient stated, I feel this whenever. So this is you organizing the data. Are you there? After that, you validate the data. How do you validate data? You validate data by, confirming the accuracy of those information given to you by the patient by, knowing the abnormal findings, all right? So that you then, compare it with the normal or compare it with whatever the patient tells you he or she is feeling. I believe you are following me. All these things are very, very easy. And the last step is to document. So whatever you have gotten from the patient, you then document it, all right, for future reference. I believe you are following me. That's how data are collected, all right. So these are the steps in data collection. Now, moving over to the next option, because we have talked about the two types of data, which are objective and subjective data. Let us stress on option C. Let us talk about what option C explains, which is evaluative statement. What is an evaluative statement? Now, listen properly. This is a nurse judgment, are you there, or conclusion about a patient's progress towards goal after care has been rendered or after care has been given. So, evaluative statement is like the nurse judgment, all right, or conclusion about a patient's health status after the care has been rendered. Evaluation is like the last aspect of the nursing care plan, all right? If we're to judge the nursing care plan, you see that evaluation is the last thing to write. You now evaluate your findings at the end. Now, listen properly. A good example of an evaluative statement is this I'm about saying, all right? You can simply use this as an evaluative statement. You can say that the patient's pain level has decreased from 8. Listen, the patient's pain level has decreased from 8/10 to 3/10 in the pain rating scale. Where, for the pain rating scale, listen properly. The pain rating scale ranges from 0 to 10. Whereby if the pain rating scale is moving towards 10, it means that the patient is in worse or severe pain. Are you there? Worse pain. Whereby 0 actually means no pain. So you can see that I'm giving you an example of an evaluative statement. You can see here I said that the patient's pain level decreased from 8 over 10 to 3 over 10 after pain medication or prescribed analgesics has been administered. So the patient's pain level decreased. So this is an evaluative statement. This is the nurse judgment or conclusion about a patient's health status after care has been rendered. Are you there? So I believe you understand what is happening. All right. You know, we have various levels in the pain rating scale. This is an example of a numerical pain rating scale that has to do with numbers, whereby 0 means no pain, 10 means worse pain. All right. From this now, you can see that it was 8 over 10, meaning that the patient was in severe pain. But it now changed to 3 over 10, meaning that the patient is now feeling less pain. I believe you are following me. All these things are very, very easy. Whereby option D is judgmental observation. Now, judgmental observation is a biased or opinion-based statement that reflects a nurse's personal feeling rather than factual or objective information. All right, this observation, this type of observation is unprofessional and it should be avoided at all costs. All right, like for instance, the nurse saying the patient is lazy and uncooperative. That's like a judgmental observation and it's unprofessional in nursing ethics and it should be avoided. Are you there? Like the nurse saying the patient is exaggerating pain. You can't say that. That is a judgmental observation. The nurse is saying it out of his or her own personal feeling. And that is not what we want here. All right. It must be based on factual and objective information before you can actually say all of those information. And it must be avoided at all costs. Because you can't just say that a patient is exaggerating pain. Because pain being defined by a man called Mago Macafari, all right, Mago Macafari said that pain is whatever the person says it is, and it exists whenever the person says it does. So you cannot just say that an individual, a patient is exaggerating pain. That is unprofessional, and that is an example of a judgmental observation. So I believe now you understand the concept to how this question was tackled critically, all right? You can see here that all of these things are very, very easy. We've come to the end of this video lesson. If you find my video lesson helpful, make sure you click on the subscribe button to my YouTube channel and also share my lessons with your friends.